Safe Streets is a public health campaign aimed at reducing shootings and homicides within targeted neighborhoods in Baltimore City, where homicide is one of the greatest risks facing teenagers and young adults. Safe Streets' efforts to reduce gun violence consist of having outreach workers intervene in and mediate conflicts before they escalate to violence, as well as to prevent retaliation. Outreach workers also seek to engage and build trust with individuals in neighborhoods to spread anti-violence messages and promote alternatives to violence. Safe Streets is modeled after the Chicago-based Cure Violence model, formerly known as Ceasefire. This model attempts to block the social transmission of violence in neighborhoods in a manner like that of a public health intervention designed to stop the transmission of diseases. The replication of the CV model began with the implementation of Safe Streets in Baltimore in 2007. Safe Streets has been making headlines recently, not in a favorable way. 3 Safe Streets outreach workers have been shot and killed within about 18 months, the most recent death in January of 2022. Baltimore City has also already seen 300 homicides this year, a number that the city has repeatedly reached for 8 years in a row. Nevertheless, as a resident of the Baltimore area, I have seen firsthand Safe Streets' continued advocacy work, which I'm wearing one of their sweatshirts that I received from a community event. That is why I chose this topic, because it's not only pertinent to me, but my community, and this project will allow me to learn more about Safe Streets. So the question I ask myself is, has Safe Streets achieved its overall goal and objectives? Given my research, I hypothesize that Safe Streets' efforts to shape community norms and mediate conflict have led to decreased gun violence rates within its targeted communities. To test my hypothesis, I would need to conduct an outcomes-based evaluation utilizing a mixed methods design. The predictor variables that I would measure would be 1, the number of conflicts that Safe Streets has intervened in, and 2, the rate of contact with individuals who are at risk. I will then separately compare these measures to the outcome variable, which is the overall gun violence rates in the city. To assess changes in attitudes and norms, I will conduct surveys with youth in a Safe Streets neighborhood. This will be used to corroborate the findings of the quantitative data. The data that I will be using will be from primarily secondary data sources like crime databases, activity logs, and news articles. For my survey, I will use the Attitudes Toward Guns and Violence questionnaire. This assesses young people's attitudes about guns, violence, and interpersonal conflict. I would utilize convenience sampling, and my goal would be about 10 to 15 participants, and the characteristics of these participants would be young men ages 18 to 24. I will utilize bivariate descriptive statistics to explore the relationships between each predictor variable with the outcome variable, which is gun rates. I would perform further tests of correlation and regression. As mentioned earlier, the results of the surveys will be used to validate the findings of the quantitative data. The topic and results from a study like this highlights the relationship between human development and the environment. Community gun violence has a widespread impact on every dimension of the lives of individuals, families, and neighborhoods, particularly for racial and ethnic minorities. Living in an environment where violence is rampant is associated with socioeconomic disadvantages, ensuing a vicious cycle of violence. The issue of gun violence and its impact on the social environment and individual behavior highlights a central theme of social work, which is the person and environment perspective. Rooted in the ecosystems theory, the person and environment perspective emphasizes the interactions between an individual and the various systems around them. These interactions in the social environment, whether disruptive or productive, can affect the social functioning of an individual. So it's the role of the social worker to improve these interactions in the relationships between a person and the various systems in their environment. The results of the proposed study can further the discussion for program leaders and city officials about how a program like Safe Streets can tap into the way individuals interact with their community with the intention to create environments that are less conducive to violence. Like social workers, program leaders, and city officials could utilize the ecosystem theory, particularly the person-environment perspective, about the other interactions to tap into and enhance other than the conflicts that go on in the quote unquote streets.